indicates that 83% of HIV-positive clients have been identified, 87% of whom are enrolled in care, and 93% of those who are enrolled have achieved viral load suppression. And perhaps to define this further, 90-90-90 is a global strategy, one that Kenya has signed on to, and you can see how we are performing when it comes to the three measures of the 90-90-90. Right now, we have 83% of HIV-positive clients being identified. We do fear that COVID-19 may actually reduce this percentage. Of those that we identify, we have 87% enrolled in care. And again, a concern here, because being enrolled in care means that you're attending your clinics and you're getting your prescriptions. And again, with COVID-19, this is bound to be affected. And then, of course, 93% of those who are enrolled achieve viral load suppression. And how you achieve viral load suppression is by taking your medications. And because of COVID-19 and reduced OPD visits, we are fearful that, again, these indicators that we've achieved may actually go down. So even with the emergence of COVID-19, as government, we continue to put in place resources to ensure that lab testing for HIV is available. Taking note that as we test for COVID-19, the very same test that is the gold standard of COVID-19, that is the PCR test, is also the very same test that we utilize when checking for HIV viral loads. And so what we've done, we've been able to look at our mechanisms and our framework, our logistic framework, to ensure that HIV testing continues on and that we're able to provide these two services when it comes to testing. With regard to our COVID-19 situation, today we have 667 positive cases out of a sample of 5,075 in the last 24 hours. And this brings to total the number of positive cases in the country to 16,268. And our cumulative cases stand at 266,102. From the cases, 657 are Kenyans, whereas 10 are foreigners. 393 are male and 274 are female. And the youngest one is a 1-month-old infant, while the oldest is 92. And in terms of distribution by county, we have Nairobi leading at 387, Kiambu at 40, Mombasa at 26, Machakos 47, Kajiado 79, Nakuru 15, Uasin Gishu 14, Garissa 11, Busia 9, Kilifi 6, Turkana 6, Makueni 5, Wajir 5, Kisumu, Nyeri, and Lamu having 4 cases, Murang'a 2, and Bomet, Bungoma, Narok, Nyamira, and Vihiga having 1 case each. And again, we've provided a distribution when it comes to sub-county disaggregation. And for Nairobi, again today, we have Dagoretti North leading. Yesterday it was Kibera, today Kibera is second at 32. We have Westlands having 32 cases, and Embakasi East having 30. And the situation continues in each of the counties, with the hotspots leading in terms of numbers. Again, to mention a few, in Machakos, Athi River remains as the lead with 41 cases. In terms of Kiambu County, we have Kikuyu having 13. We have Kiambu having 6. We have cases in Gatundu South, Kiamba, Lari, and Ruiru having 4 cases. And in Mombasa, Mvita again leading with 13 cases, and Jomvu having 9. And we've provided for you the disaggregation by each county, by each sub-county, with the highest county to the least county. On a positive note, 311 patients have recovered from the disease, and out of this, we've had 166 from the home-based care program, while 145 from various hospitals. And this brings the total number of recoveries in the country to 7,446. And we continue to thank our healthcare workers for this achievement. Unfortunately, we've lost 11 patients from this disease, bringing our fatality to 274. And what was striking for me today as we reviewed this mortality data is that we've actually lost a child due to rickets. And I found it necessary to really highlight this today because even as we impose physical distancing, even as we say stay at home, then it means that if our children are staying at home, particularly those who live in apartments or areas where there are no fields, then it means that there's a risk when it comes to rickets. And how to take care of rickets is to ensure that your child has access to vitamin D, which is best sourced from the sun, and a healthy diet. And so the fact that for the first time we've actually had a fatality and that this child had rickets really is a cause for concern. It means that we need to relook to see as parents, even as we have our children in the houses, how can we ensure that there is an element of sun exposure and, of course, healthy diets. We continue to pass our sincere condolences to the families and friends of those who've lost loved ones during this pandemic. And finally, we would like to reiterate that our health facilities countrywide continue to be operational for treatment of all other diseases, not just COVID-19. And therefore, we appeal to people not to shy away from utilizing services, and this includes the HIV testing services that we've discussed today. We have seen a decline in terms of service utilization, and we do continue to remind you Kenyans that if you are unwell, you should go and seek care at the health facility. Our healthcare workers remain ready and willing to attend to all ailments and not just coronavirus. So let us make use of these facilities. Thank you.